Good afternoon, good morning, good evening, ladies and gentlemen. Welcome to the Gain Biofortification webinar, which is aptly themed Gender Nutritional Strategy. Our conversation today is going to revolve around the role women play in sustaining livelihoods and also encourage participation in the development of agricultural strategies such as biofortification. At the same time, it will also be adhering to the 4 pillars of food security, which is accessibility, availability, utilization, and stability. And of course, we're very proud that this webinar is brought to you proudly by the Global Alliance for Improved Nutrition. We want this to be an engaging and a dynamic conversation, so please put your questions in the Q&A, and we will direct them to our world-class speakers today, whom I'm really looking forward for this engagement or discussion today. Yes, but first, let's check out the amazing work that GAIN is doing in India in the areas of nutrition. And yes, of course, we have an amazing, talented, world-class list of speakers today, and they're going to focus on 4 major areas. The first area they're going to focus on biofortification as an alternative tool in fighting micronutrient deficiency, especially for women and young children in the areas of zinc, iron. And also, second would be they're going to highlight the nutritional challenges women and children face, more so in low and middle income economies. Then the third would be they'll focus on the role women play in the biofortification value chain to ensure that there's an increased reach for minerals and vitamin A. And then the third, this would be a forum for ensuring learning, experiences and sharing that would enhance fair and equal participation of women in this space. So yes, thank you, and let's start by the video from GAIN India.
India is on the path of rediscovering the power of millets, the potential solution to agrarian and nutritional challenges.
Nutrition-smart agriculture is fundamentally a need of an hour, as it directly impacts people nutrition, especially the most vulnerable ones. Policies to strengthen nutrition-smart agriculture should be ranked higher, as it will help to build the block for food systems that promote healthy people, a healthy planet, and healthy economies.
मेरे गांव का नाम जहांगीरपुरा है और मैं सिखराइते स्कूल में रहती हूँ। दौसा मेरे जिले का नाम है। हमने सिजेंडा फाउंडेशन से HSP 299 का बाजरा लिया था, वो हमारे बहुत अच्छा हुआ है और अगली बार भी इसी को गाना चाहते हैं क्योंकि एक ही पेड़ में कम से कम 7 से 8 किस्म हुआ है। कम से पका भी अच्छा है, उसकी बारियां भी अच्छी आई है। अभी हमने एक खेती बोया था, अगली बार हम अपनी पूरी जमीन में यही बाजरा बोने करते हैं। धन्यवाद।
Thank you very much. Just going through the video, the statistics are quite telling. They're very striking fact because, just in India alone, you have over 200 million people who go through micronutrient deficiency. And according to the latest statistics by FAO, we have about 500 million people who go through this. And that's why we are here. We're here to explore pathways. We're here to explore conversations. We're here to build upon ideas that can actually incorporate women in this fight against hidden hunger. At this point in time, it gives me so much pleasure to actually introduce our chief guest for today, who will be representing the President's Office of Regional and Local Government Administration. She's a nutritionist and she has a master's in public health from Muhimbili University. She's representing Muta Waibe, who is the president of the President's Office Regional Local Government Administration Tanzania. Her name is Neema Kweba. Welcome.
Yeah, I'm sorry to say, Neema, you're muted. You'll have to unmute yourself first, please. Thank you.
Sorry, everyone. Good afternoon, good morning once again. My name is Neema Abel-Kwebe, a nutritionist at President's Office, Regional Administration and Local Government in Tanzania. Dear ladies and gentlemen, I would like to acknowledge everyone present today. And even as we come together to explore the gender-inclusive nutrition strategy in biofortification. Today, we will discuss a lot, and we acknowledge that every day women around the world make critical contribution to food systems at the households, community, region, and at the global level. To take out, for example, a mother in Tanzania who tends to grow her maize field, pro maize with vitamin A, harvesting and storing the crop to feed her family. The woman sells her nutritious iron beans in Kenyan markets. A young woman who is an agropreneur who produces nutritious foods made with vitamin A and cassava in Nigeria. These women delivering micronutrients, enriched by fortified food to their community are of a great contribution to improving nutrition and the health of the household members and the community at large. They also play a key, they are also key players in transforming their food systems and deliver healthier diets. But also, as we are in the movement of achieving the Sustainable Development Goals, the Sustainable Development Goal number 2 seeks to sustain solutions to end hunger and in all its forms, by the year 2030 to achieve food security. And the aim is to ensure that everyone everywhere has enough quality food and food that leads to healthy life. Hunger has both conceptual and experiential complexities. Hidden hunger is a disorder caused due to lack of vitamins and minerals. And in Tanzania, we have issues with malnutrition due to hidden hungers. And the importance of essential minerals and vitamins in the diet as they are absorbed in the body is crucial. As we all know that WHO in low and middle income countries uh, has said that we do not get enough essential vitamins and minerals in our diets. Therefore, common forms of hidden hunger, for example, vitamin R deficiencies, nutrition and anemia, endemic goiters, iodine, zinc deficiency, and folic acid deficiencies are of a great challenge in our countries. And as we speak now, we, over recent research, have seen a decrease in some of these indices, but they are still at a higher level. For example, we have 28.8% of women who are non-pregnant who are suffering from anemia. But we also have issues of vitamin R deficiencies, iodine deficiencies. And here as a country, we're struggling to see how we can enable our communities to get salt that is iodized so that we are able to curb the iodine deficiencies in children who are developing. Also, in order to avoid hidden hunger, diet must contain 19 to 51 micronutrients essentials for physical and mental development, immune system functioning, and various metabolic processes. In effect, hidden hunger is akin to having micronutrient deficiencies. Um, the entitles improving the productivity and incomes of small-scale farmers by promoting equal access to land, technology, and markets, sustainable food production system, and resilient agriculture practices. Also, here I would also like to say that we have seen several UN agencies trying to come up with different ways to address the issue. And on April of 2016, the United Nations General Assembly proclaimed that 2016 to 2015, is the United Nations Decade for Action on Nutrition. And this decade is an unprecedented opportunity to address all forms of malnutrition. However, despite the long historical and cultural associations between women and food, only recent a feminist perspective has been brought to perspective to the study of food. The division of labor between men and women in production and processing of food varies greatly according to the region and individual communities. However, in general, women take care of our households, food production, small scale cultivation of cash crops, while men tend to be responsible for large scale cash crop production and heading the livestock. Men in our communities, men are especially involved in cash generating activities associated with mechanization. For example, uh, women produce most of the garments. Men are changing, selling such products. In such contexts, women remain almost fully dependent on men to turn their labor into cash needed to purchase food food is profoundly a gendered issue. Ladies and gentlemen, women are primarily responsible for the purchasing and cooking of food, and they have a central role in allocation of food that impacts the nutrition status of family members. Women play an important role in food production. Policy interventions in food and nutrition are prevalent and are often provoked much political labor. They impact on culture, economy, and the lives of women in developing countries under theorized. Men and women have different roles in the adoption and access to new technologies, participation and access to markets, and decision about processing and storing crops. Both gender perspectives must be carefully considered when delivering nutrition-sensitive agricultural interventions. I firmly believe it is only by integrating and promoting a gender perspective into our work, we, with the population in danger, have to promise success. According to the World Food Programme, 8% of produced labor in rural Africa and 60% in Asia is provided by women. Only by harnessing these potentials can we take a step towards alleviating hunger and food insecurity and promoting sustainable development. Ladies and gentlemen, according to IFPRI discussion paper in 2014, titled Baking Power and Biofortification, the role of gender in adoption of orange sweet potatoes in Uganda, the authors found that in female-headed households, adoption of OSP was positively correlated with the amount of land controlled by the adult female households members. However, adoption declined when the share of non-assets held by women rose, perhaps signaling that women's focus in income-generating activities outside the house, as opposed to farming and crops choices. The study established that female-headed households already growing sweet potatoes were more open to trying the biofortified varieties and parcels of the land exclusively controlled by men, exhibited the low level of orange sweet potatoes adoption. Firstly, the land under joint control, although with the women leading crop decisions, exhibited the highest likelihood of OSP adoption. Even when women take the lead in crop choice, the decisions are generally made jointly with their husbands, so nutrition programs should be targeted appropriately for both genders. From the government and experts' perspectives, women's food knowledge, cooking ability, feeding practices, and breastfeeding patterns are the means to solve the food problem, precisely because they are the origin of that problem. It is in this sense, women's visibility is rooted in committing a sin and providing a solution to rectify it. New cultural technologies, such as biofortification, need to meet the consumer preferences of both male and female farmers, the nutrition needs of multiple subpopulations, especially women, adolescent girls, and children under 5, who have the highest nutrition needs, but often most limited access to nutrient food, dense food. Support gender equitable decision-making and avoid unintended consequences to women, such as increased workload and loss of income. Demand for biofortification crops and food production is growing rapidly, particularly among women who see them as a way to affordably provide nutritious food to their families and communities. Women also see opportunity through biofortified crops to establish small and medium-sized enterprises that process the market of biofortified foods. In conclusion, the good news is that gender is a key factor in setting the nutrition targets for breeding biofortified crops. For example, breeding partners can develop variety with shorter cookies time than non-biofortified varieties, which may give some more time to engage in other activities. As I conclude, I would like just to tell you that scaling up biofortified foods with gendered consideration and supporting women in small, medium enterprises are only the examples of how institutions are prioritizing women in food systems. Hence, there is a broad agreement that an overhaul of food systems needs to happen. However, true it is, transformation cannot be achieved with a prominent role of women around the world. Thank you very much. Over to you.
Thank you so much, Naima, for that amazing speech and for the insight that you've given us that women are very crucial stakeholders in our nutrition as they choose the kind of food that we have on a day-to-day basis and in effect affect the diets of children and I think men and the whole world as a whole. And hence it's important that that agricultural development strategies such as biofortification are responsive to different gender preferences, most of our women. Thank you very much. Having said that, let's see the amazing work in biofortification that GAIN is doing in Africa. We've gone through Asia. Let's go through Africa. Thank you.
Nutrient malnutrition, known as hidden hunger, is caused by a lack of vitamins and minerals in the diet. It affects hundreds of millions of people across Africa and leads to a range of serious health issues. 69% of Kenyan children under 5 suffer from iron deficiency. Vitamin A deficiency is a key challenge for 36% of women in Tanzania, while in Nigeria, 1/3 of young children and 1/4 of all pregnant women are vitamin A deficient. The access to nutrient-rich foods is limited, as local diets are dominated by low-nutrient stable foods. One proven solution to hidden hunger is called staple crop biofortification. It is the process of breeding crops to increase their micronutrient content. These include high iron beans, vitamin A maize, and vitamin A cassava. Scientific research has shown that consuming biofortified crops improves nutritional status and health when they are eaten regularly. It can reverse iron and vitamin A deficiency, but also improve memory, attention, and strengthen immune systems. In 2019, GAIN and Harvest Plus formed a partnership to launch the Commercialization of Biofortified Crops program. 2 partners work with seed and food value chain actors, such as seed producers, farmers, aggregators, and food processors, to expand the commercial reach of biofortified seed, grains, and foods. In Africa, the program efforts are currently focused on 3 countries, Kenya, Nigeria, and Tanzania. The main objective of the program is to improve the nutritional status of the population, but the commercialization of biofortified crops also brings benefits to the economy. It enables SME entrepreneurs in seed, crop, and food value chains to establish and grow businesses using and producing biofortified products.
As a food processor, we have been finding it difficult to get access to raw material like this grain, vitamin A maize, and vitamin A cassava tuber. Because of this CBC project, because at this stage now, what they did last year is to make sure that farmers plant all these products, the raw material we are using, like the cassava itself, the maize grain itself. So the program now, the benefit of it to my field is that I can now have access to the raw material I'm using, which is the vitamin A cassava tuber and the vitamin A maize grain. I have it at any moment, anytime I want.
Feedback from businesses and stakeholders in Kenya, Nigeria, and Tanzania have indicated that the biofortified foods are providing new opportunities for them.
This program is contributing to the livelihoods of many farmers. They said that beans is a staple crop in this country, and it is also planted by millions of farmers, and especially women, and creating a lot of employment at the grassroots level. For that, I would recommend it, as well as the contribution it is making to a reduction of malnutrition, because it is a staple that is eaten by millions of households.
Almost everybody gains from the program in terms of the key actors in the value chain, from the seed producers to suppliers, processors, schools, teachers, students. So in Tanzania, it's more of a project of the people, because everybody is willing to take it in and act in order for us to solve the malnutrition problem. But also we have the government whom we are working with. When we look at the school feeding guidelines, which was launched lately, it gives us a room to actually work with broader areas in different regions, since we have a backup from the government. So when we emphasize on the use of biofortified food, it really makes an impact, because there's a government backing us up. So it makes the project run very smooth.
Scaling up commercialization of biofortified foods will pave the way toward reaching hundreds of millions more households across Africa, to improve nutrition and to end hidden hunger. The CBC program welcomes new partnerships with value chain actors. Join us in making staple foods more nutritious and profitable for Africa's farmers and consumers. Help us end hidden hunger.
Thank you very much. I hope you've all enjoyed the video. And now it gives me so much pleasure to introduce to you the guy who's actually in charge of all the amazing work that you've just seen in Africa and in Asia, and he's in charge of the program in 6 countries. Yes, I'm very, very happy to see him, as you can see. Yes, over to you, Ishank. Oh, I forgot to mention he has a master's in business administration from Symbiosis International University with a specialization in communication and advertising. Take it away.
Thank you, Felix. Thank you. And first of all, let me thank all the dignitaries who have joined us today, and especially Nima for those wonderful insights. I'll just, before speaking on the topic, I'll take you through a little bit about what the program is. I'm sure that you must have seen the video and realized what we are all about, but just give me a moment. I'll take you through what I have in mind in a second. Yeah, so this program is called Commercialization of Biofortified Crops, and it's a partnership between GAIN and Harvest Plus, with funding from the Dutch and the German Federal Ministry of Economic Cooperation and Development. As I said, I'm honored to be a part of the webinar, and I think most of what the challenge is globally has been addressed by Nima already. But you see, 2 billion people, primarily in low and middle income countries, do not get essential vitamins and minerals in their daily diets. We call it micronutrient deficiency, hidden hunger, and a lot of different technical things. But at the ground level, how it severely impacts the health of women and children specifically is really heart-wrenching. We're talking about diseases and challenges of blindness, stunting, poor brain development, weakened immunity, and anemia. And especially after the COVID scenario, how it impacts the world population is very, very clear to all of us. And speaking of all of the hidden hunger specifically, and all the challenges that we have around malnutrition, whether that be around long-term wasting and type 2 diabetes, high blood pressure, obesity, anemia, and stunting, one thing that is a common denominator to all of this is poor diets. It is at the core and center of all the challenges that we have around nutrition around the globe. And we all know that there are several strategies to combat it. There's food supplementation, very successful large-scale food fortification, and the other and rather novel strategy that we are all discussing today is biofortification, specifically of staple food crops. We all know the benefits. I would not go through all of this in detail, but just to reiterate, it is a sustainable and cost-effective way to combat malnutrition, and with a specific benefit of more access to rural population, more access to people living in people in low-income groups, and also it is an environment-conscious strategy when you look at battling malnutrition in a 50-year time frame. As far as the program objective goes, we are here to improve the access to inputs and markets of biofortified seeds and food products, improve the demand for these nutrient-rich staple food crops, and generally the enabling environment for these food products in 6 countries, and also have a global impact as we move along. We are looking at a coverage of at least 165 million by end of this year, and we are pretty close to getting there. These are the 6 countries. 3 countries were mentioned in the video, which is Nigeria, Kenya, and Tanzania, where we are working with the maize, cassava, and beans, rich in vitamin A and iron, respectively. And in the Asian countries, we are in Pakistan, India, and Bangladesh, working on wheat, rice, and pearl millet. As far as the program approach goes, usually when we are talking about the agri sector, food value chains rather, there are different approaches in which programs, tackle and look at nutrition. Some have a purely farmer-centric approach, which honestly is quite common, especially in the developing countries. And then you have a holistic market system approach. What our program, entails to do is to have a value chain approach, which simply means that we are not here to disrupt the existing value chains, but rather work with them, work with the existing actors, right from the seed production to the food retail, and make them more conscious about nutrition, make them more aware about the biofortified foods that are available, and literally nudging them to adopt our varieties gradually in the coming years. And this is what the whole project operations look like. It's not very different from any other agri value chain program, which is working from one end to the other. So we have things working around the seed production, seed marketing, distribution, and then we work a lot with the farmers around and the farmer groups, microfinance institutions, and take care of grain production, aggregation, their transport, warehousing. And later on, we develop forward market linkages, which is basically another way of saying that we get more of food processors and private companies on board. A few of them we are honored to have in our webinar today, so that we gradually create a demand for biofortified foods. And we have multiple partners. I think at the moment we are working with 50 different organizations and agencies who are helping us achieve what we achieve the goal of 165 million consumers. But you see, when we talk about such programs and purely of operations, this looks like a lot of just business development, if I may, working with different actors and making sure that they come on board and work with us, adopt the varieties. There's a profitability element, and so on and so forth. But while conceptualizing this program, we understood that we'll have to look at the whole program, not only from an operational lens, but there are a lot of other factors involved, which are critical if we are to say that we are in the development sector and working for the betterment of people. Especially around the topic, we understand that women play a very important role in our value chains. As Nimont also mentioned, they are critical contributors to food systems, and providing on-farm labor, household food and nutrition security, as well as the participation of women in commerce cannot be negated. We saw a lot of data and studies, that Nima also shared, and you must have come across, specifically the studies that have shown that when women receive the same amount of inputs as men, and gender norms and other constraints to their participation in agriculture are considered, their productivity increases dramatically. Yet, Women are faced with key constraints on farm, across the value chain, and in distribution of benefits, from limited access to agricultural inputs, lower technical skills, and poorer access to finance and markets, to relatively weaker bargaining power within the household and across markets. These obstacles and all the data that you see in front of your screen are related to gender. Driven by social and cultural norms, these posed critical risks to effectively mobilize female farmers and entrepreneurs to grow biofortified crops, manufacture biofortified enriched foods, and invest in biofortification along the value chain. So we are aware of this. There's a lot of data, there's a lot of infographics, there are a lot of organizations talking really about the same topic over and over again. But you see, when the program pathways or when these crop value chains are far more convoluted and complex than in the slide you see in front of you, it is easier said than done. You see, we had the opportunity, GAIN and Harvest Plus had the opportunity to incorporate gender in the design of the program. We ensured that the gender dimensions are intentionally integrated in the program, especially during its design, so that in implementation, we can effectively track and measure the impact that our program is having on women. But how do we do it? You see, as far as the framework is concerned, we have nutrition right at the center, and something that we cannot do without considering we are a nutrition organization. And commercialization, it's literally in the name of the program, which drives the profitability. What we really had to do was add another layer in which we talk more about livelihoods and empowerment of not only women, but have more empowerment opportunities to youth-centric organizations as well. So this basically formed the pyramid in which we talk about not only profitability and consumption of these foods, but also talk about how do we ensure that we engage with more women organizations, so that we not only improve their nutrition, but also help them in profitability, also empower them, and make their own business model sustainable, regardless of if they're working on biofortification or not. Apart from this, environmental sustainability and innovation also happen to be our key pillars of the program, is something that we've extensively discussed in our previous webinars as well. So as when it comes to CBC gender, our approach was rather very simple. Our intention was to increase the opportunities for women's participation in growing, marketing, and consumption of these nutrient-enriched staples. Over these years of implementation, we are ensuring that gender is a routine component of all programs, all the partnerships, and the indicators are disaggregated by gender wherever feasible. We're exploring opportunities for working with women smallholders in value chain actors by promoting agricultural and nutrition policies, the resources, and we are prioritizing programs that recognize potential of women's multiple roles in food production and the multiplication. Long story short, I think when we are to work on any of such programs on agricultural value chains, we have to look at it from a gender perspective, and we should be intentional to prioritize, enroll, monitor, and report on gender and women at the farming level, at the aggregation level, at the food processing level, retail level, when it comes to value-added foods, and last but not the least, the consumers that we are ultimately aiming to reach. We have a lot of case studies with us. With that, we are more than happy to share. But I think there are 9 more speakers that go after me, and I'm sure some of them will talk about how they've engaged with CBC as a program and with a gender-specific lens in the years that we work with them. Thank you very much, and I guess back to you, Felix.
Thank you very much, Shank. It's so evident, just going through the program design for CBC, that women are actually key players across the whole value chain, right from seed production, marketing, distribution, all the way. And that is why we want to ask our participants today this series of questions, just to know how gender aware they are, or sensitive, so that they can mainstream gender in this line of work and field. So you're going to have a series of 3 questions, which you're going to launch right about now. You're requested to answer those questions on the Q&A. And we'll just have the results in a few. So the first question is, do you believe that rural women's access to financial resources is a key factor for executing agricultural development strategies such as biofortification? I repeat, do you believe that rural women's access to financial resources is a key factor for executing agricultural development strategies such as biofortification? Yes, I'm seeing 100%. Okay. And the no's? Number 2, does the lack of information and traditional social rules restrict rural women from having sufficient capacity to gain access to other sectors and achieve higher incomes through biofortification? The question number 2, does the lack of information and traditional social rules restrict rural women from having sufficient capacity to gain access to other sectors and achieve higher incomes through biofortification? Number 3, what are the factors you think restrict women from actively participating and influencing agricultural value chains, especially in the rural households? Option A, lack of information. Option B, financial constraints. Option 3, low exposure to livelihood opportunities. Option 3, cultural misconceptions and others. Yeah, so you have about a minute just to answer those polls. I'm going to give you a minute. Poll questions.
Know that there is more life than enough. And I don't care because I'd rather be here with you, with my friends. And I know that might sound a little strange, but don't you know your love is taking me over? If you don't, that's okay, just let me show you. Oh, that's alright, you can waste my time. When you see I like you, you know what to. So what's it so hard for you? Tell me the truth. Tell me the truth. Oh. Once again, all sold out of hope, but you don't mind. But I was thinking one day I could call you mine. So if you know that this is the way I feel, can I be sure that you can make my dream real? And if I can't, well, that's okay, I'll just use my imagination. Cause thinking of you is like my daily meditation. And I don't know if it's right or wrong. I just hope you hear this song. Tell me what you think.
Thank you very much. So we just go to the results and see what are the findings. Question 1, 86% of people believe rural women's access to financial resources is a key factor for executing agricultural development strategies such as biofortification. 86% believe that, 14% don't believe that. And then question 2, 92% believe that lack of information and traditional social rules restrict rural women from having sufficient capacity to gain access to other sectors and achieve higher incomes through biofortification. And then 8% don't believe that lack of information and social rules is a restriction, is a barrier for that. Then number 3, the last question, what are the factors you think restrict women from actively participating and influencing agricultural value chains, especially in rural households? So 76% believe lack of information is actually the answer. And then the other people believe also that other than lack of information, they believe that restraint by social cultural norms. Yeah, so it is evident from this poll that financial backing is very important. Social and cultural norms play a huge role. And then also education and just civic awareness on the part of women plays a key role, and it's an intervening variable if at all you're supposed to make change across the value chain. Yes. At this point, I'd want to hand over the program to Annette Nyangaresi, who's my colleague. She's a research associate within the Commercialization Biofortified Crops program. She's going to be managing the panel discussion, and I believe you've got amazing speakers, you know, who are just going to unpack gender integration within this realm of biofortification and just food systems as a whole. So thank you very much.
Thank you very much, Felix. Good afternoon, everyone. Good morning, good evening, wherever you are. Thank you so much for attending this webinar, and thanks to the previous speakers. My name is Annette Nyangaresi, as Felix has already said, and I'm very delighted to be moderating this panel discussion. And today we are privileged to have 5 panelists who will give us some insights on how we can apply the gender lens or the gender perspective while designing, planning, and even implementing programs that consider strategies like biofortification. So before we dive into the discussions, I'm going to give the panelists a chance to introduce themselves in less than a minute, if that's possible. And our first panelist is Javed Ahmed, who is a chief scientist at Wheat Research Institute. Over to you, Javed, for a brief introduction.
Thank you. I'm Javed Ahmed, working as chief scientist, Wheat Research Institute, Faisalabad, Pakistan. Main responsibility of my institute to breed new varieties of wheat crop, which is staple food in Pakistan. So for the topic, I must say that for the low income countries like Pakistan, the malnutrition is a big challenge which has to be addressed, and the female are most affected by this malnutrition problem because there is a little imbalance on the basis of gender equalities, especially in low-income areas and among the rural communities. The preference is given to male community, believing that they are contributing more in income generation. But my belief is that women can contribute more in addressing the issue of malnutrition because that's a women who controls the food supply in a household, and especially the selection of food, then processing, cooking, everything is in the hands of women. And there are different ways which we suggest for improvement of nutrition, the food diversification and supplementation. These are a bit beyond the control of low-income people, and also the fortification of products. But the most sustainable and economic way is fortification of staple food crops. So we worked on development of more nutritious wheat, and our success is very good till now. We have developed Akbar 2019, Zincol 17 and WAP 21 wheat varieties which are high in zinc, and due to their high zinc value and more tonnage in the field and less vulnerability to environment and biotic and abiotic stresses, that are becoming more and more popular. And Harvest Plus helped us in development of these varieties, and GAIN is supporting us and going hand in hand with us for promotion and commercialization of these crops. And the women can play their pivotal role in dissemination and adaptation of these varieties. These are the women who can force the male to grow these varieties, and then they will be responsible to separately mill that and provide the our staple food chapati to the household by this fortified wheat. And in this way we can make a better nutrition for Pakistani people. And it is believe that women can disseminate the knowledge in a better way than the males due to their more social interactions with each other, and the communication from women to women that's more acceptable to others. And in this way, and also if we go back for the seed selection and seed products processing, cleaning, women have major roles in farming community, and there they can also promote the high zinc wheats. And if we empower the women and we are able to guide the women and to make them just accepting the knowledge building for adoption of these high nutrition crops, if they contribute in this cause, that will be very easy to make the community more nutritious.
Thank you very much, Javed, and for giving us a brief about what you do. Now moving on to the next panelist, who is Umar Arshad. Over to you for a brief introduction.
Thank you, Annette. So my name is Dr. Umar Arshad. I'm working as a professor of food science in Government College University, Faisalabad. And I'm also working on different projects previously on particularly on fortification, on large scale fortification. Particularly recently I've completed my project with GAIN that was for the provision of the nutritious fortified wheat flour and fortified foods to the social welfare sector, particularly the food distribution networks around the country. So similar kind of assignments I have already completed. And regarding the biofortification, I am also in close collaboration with GAIN and Harvest Plus in Pakistan for the commercialization, segregation, and all other future aspects of the biofortified wheat varieties, as mentioned by Dr. Javed in Pakistan. So thank you so much. It will be nice talking to you during this panel discussion.
Thank you, Dr. Umar, and apologies for dropping that title when I was introducing you. Now, moving on to the next panelist, Minor. Could you please introduce yourself?
Yeah, thank you so much, and good afternoon from Bangladesh. My name is Munir Jaman Bipul. I am working as a portfolio lead here and leading the diverse food system transformation cluster in Bangladesh with some 4 or 5 projects. Along with this, I'm also learning on the commercialization of biofortified products and also trying to leveraging in our all other products. So maybe there is a chance I will share some insights on this. So talk to you later on. Thank you.
Thank you very much, Minor. Now moving on to the next, Nurul. Over to you.
Good morning and good afternoon, where you are. My name is Nurul Afsar. I am the former Director General of Food. Worked there for 30 years in the public food distribution systems. And after retirement of the government service, I joined the World Food Program for piloting the flour fortification. At the beginning, I started with a 3 sites, and then subsequently it covered at least 40% of the area. Then I started working with the rice fortification with a synthetic micronutrient. And that project is still going on with the WFP, but I retired from WFP. And then I joined the FAO as a national team leader to work as a food safety, to assist the Food Safety Authority of Bangladesh. And at present, I am now working with the GAIN and the Gorai Film for CBC project, especially for the bio-zinc rice. Thank you.
Thank you very much, Nurul. Moving on to the next panelist, Ms. Samina, over to you.
Hello, thank you. My name is Samina Nazir. I'm founder and president of PODA in Pakistan. It's a women's human rights NGO, and we are working for the promotion and protection of human rights in rural areas of Pakistan. And one of the main activity that we do is to work for building the capacity of women farmers in all areas of their agriculture work. And we have been organizing an annual conference of rural women leaders to come together and discuss both their challenges and the contributions they are making in the agriculture sector. We also work on the policy improvement and have been suggesting more funding and more focus on the issues that affect women and girls' nutrition in Pakistan. I look forward to talking to all of you.
Thank you very much, Samina, Ms. Samina, and thank you to all panelists for being present today and looking forward to these discussions.
I think I'm left.
Oh, sorry. Sorry,
Yes.
Please go ahead. Apologies.
Yes. It's okay. Yes, thank you so much. This is Nazdin Rahman. I'm a nutritionist and public health professional with 18 years working experience. And in the area of maternal and child health. I'm currently working with Care Bangladesh as a senior team leader, overseeing a nutrition governance project. And also I'm representing, as co-chair for Civil Society Alliance for Nutrition. So we are, as a civil society, we are, creating evidence, advocacy, doing advocacy and to policy influence. Thank you.
Thank you very much. And sorry for leaving you out of this. Yeah, but again, like I was saying, we look forward to these panel discussions. And perhaps if I can just jump in straight to the questions, I'm going to ask the first question to Javed. Now, examples in inequality between men and women in food systems remain plentiful because the gender gaps that disadvantage and marginalize women are endemic to those systems. Now, in your view, why is there a need to make significant progress towards gender-responsive agricultural innovations that support women? Javed, please.
Yeah. As I already mentioned during intro, that the mostly in rural areas and low-income families, the responsibility of food preparation, food selection, and food processing, cooking, all that is the task of women. And she has to decide what type of food to make and provide to her family. They can contribute more in making food more nutritious for her family. And our main task is to educate her and convince her on use of biofortified crops, because in developing countries, low income is the problem, and we can't afford expensive supplements, food supplements. So we have developed genetically biofortified crops, especially I'm working on wheat, and we have varieties like Akban 19, which has a 39 to 40 ppm zinc. So now we have to convince the community to use that, and we are working on it by the collaboration of Gain and Harvest Plus. We are involved in CBC program, and we need to do it on a more larger scale, so that community can use it, and especially the women, if once they are convinced, they can go further and also disseminate it to their community, the other women, and ultimately it can easily spread all over the country.
Thank you very much, Javed. And now to our next question, and this is to Dr. Umar. Dr. Umar, men play a leading role in crop choice decisions within the household, but studies show that women also play an active role in crop selection, particularly for food crops for house consumption, and that women commonly supply labor to household farms. Now, how can programs be more sensitive and conscious towards women while scaling up, especially for strategies such as fortification and biofortification? Dr. Umar?
Okay, thank you. Can you hear me?
Yes, we can hear you.
Okay, thank you. Okay, so thank you, Anand. Women, as Dr. Javed mentioned, has very critical and pivotal role in both from consumption, from business, or from segregation or commercialization point of view of these kind of agriculture programs. So any program that is being implanted in future to sensitize the community, that should be focused on the women, and all the policies that should introduce and encourage, like creation of small rural agro-based industries at different levels. For example, we have seen that in our Pakistan, the most of the population are getting the wheat from the small scale chakkis and small scale milling units. According to an estimate, around 65,000 chakkis are working in Pakistan for production of whole wheat flour and flour. So these kind of chakkis are available, and any program that is targeted for the fortification as well as the biofortification, fortified wheat flour, could only be successful if we can just sensitize the women in this particular sector. So what I'm saying that at the time of during the value chain, at the time of production, if we can introduce some strategies to for specifically for women, so that they can generate more business and they can be more involved in segregation of the wheat, the biofortified wheat from the non-fortified wheat, and these kind of activities. Plus the women are kind of they're deprived of the extension services, they're deprived of the businesses when we talk about the agriculture businesses particularly. So it could be a better strategy to involve them in these kind of small scale agro-based processing businesses that can have better impact on that. Otherwise, in the large scale fortification, flour mills will have a tough time to introduce our segregated biofortified wheat varieties, which is happening right now in Pakistan. So we should start it from the small scale chakkis, and women should be involved in those small chakkis, and some of the chakkis are already being owned by these women. So this could be one of the strategy. So, and secondly, women should be trained on the segregation particularly, and on the production of the biofortified. And then lastly, the women sensitized awareness programs, as Dr. Javed mentioned, they are very, very important to spread the awareness among the community, among their own households, and to improve their household nutrition as well as the community nutrition at large scale. Thank you.
Thank you very much, Dr. Umar. Now moving to the next question, which is to Monir. Now, how do you think a series of gender-related measures can be established to ensure greater participation and leadership by women in commercializing staple crops? Do you have any examples you would like to share from your experience of working on drivers of food systems transformation?
Yeah, thank you so much. I think this is very important point to actually identifying first the driver. I think woman is the driver in should be in our all cases, and I can cite an example who is our commercialization of biofortified rights producer, that is Miss Hilom. Is from the marginal community, and the last 2 years she tried to cultivate paddy, and last season he really got a good harvest product, and almost it was 3 tons. And this how she made it. Actually, she first changed her mindset to do this project, do this cultivation from the subsistence level to make it more commercial agricultural mode. That made her first very committed to drive on these interventions. And then so far our projects, we tried to make her technical capacity building in terms of smart agricultural practices, and then the business orientation. We are in our country, we are leading the Sun Business Network also, that connected that lady to make her business not like a general farming. This is a business orientation farming. And second thing need to be considered very clearly, that is the access to technology and innovative technology, whether it is seed or any software technology or the marketing style. So this kind of things, when a people or a group of producer can have some access to build his or her knowledge and skill, then the tangible things should come a very commercial way. This is the point to make our audience very clear, that whenever we want to make a women very empowered socially, bring some social capital, human capital, we need to actually introduce or start intervention with her with a business plan first. And if it is the business plan in agriculture or any other occupation, then that person really drive the pathway need to be achieved the outcomes. So we have to focus on the modality of the farming from subsistence level to commercialization level. So this is our learning from our current interventions. Thank you so much.
Thank you so much, Monir, and for the insights. And now moving on to the next question, which is to Nurul. Could you please mention some of the innovative approaches that changed women's and men's attitude to gender and supported women empowerment in food systems in Bangladesh?
Thank you very much. As you know, women are producing 50% of the world food grains in the world, and they are the best player, better half of the production systems. From my experience in Bangladesh, I would like to say that government of Bangladesh is taking a very great step to empower women. And although the Bangladesh is becoming a middle income country, still a large portion of the people are under the extreme poverty and other vulnerabilities. Therefore, government is providing social security services and benefit to the reduce vulnerability, and promote resilience to shocks and stresses in individual, household, and community level. One of the example worldwide, Bangladesh is operating a BGD program. It's called the Vulnerable Group Development Program, which cover 1 million distressed women who are the ultra poor, who cannot afford to have a consume less than 1800 calories per day. Government select those 1 million people for a period of 2 years cycle, and the government provide 30 kilo of ration, family ration, to those women. Vis-a-vis, those women are given training for income generation, like homestead gardening, poultry rearing, cow rearing, and also other kind of small shops, vendoring, all kind of income generating activities. And they are also tagged to the NGOs who provided the microcredit. Once they completed the 2 years, they are entitled to have a microcredit from those NGOs, and taking those microcredit, they start the business, small business. Yes, yes. Business, and they become a successful in their life. In this way, Bangladesh government is empowering the women in Bangladesh who are in distress, and due to financial conditions, sometimes they are also the climatic distress, to become a successful and survive. Okay, thank you.
Thank you very much, Nurul, for giving us those examples on innovative approaches. Now, the final question to this round of questions goes to Ms. Samina. Ms. Samina, inclusive and participatory efforts are essential in reshaping social structures in food systems. Now, in your view, in what ways can boys and men be engaged to restructure the food systems?
So boys and men's role in agriculture is linked with their role in society. Pakistan is an agrarian society, and it's a gender segregated society. So men and women have specific roles. I think that there's need to change the roles and teach men and boys about nutrition, so they understand what are the nutritional needs of women and girls in different stages of their life. So in Pakistani society, if women are working in agriculture, it is the men who go to the market and they buy the seed and they take the crops to the market. And most of the time, it's the men who interact with commercial seed and fertilizers companies, and they get motivated by the desire to have quick cash. So a lot of times they will choose crops that will bring them quick cash, 2 crops a year, instead of crops that are more nutritional and meet the needs of the family. So women need to be involved in the decision-making, and men need to learn about the nutritional needs of women and children, so that, for example, if you have a small piece of land, all the land should not be used for cultivating cotton or wheat. A little part of the land should be reserved for vegetables and fruits, so the family can meet its nutritional needs. Because a lot of times people don't have money for fruits and vegetables, but these are things that are needed to meet the nutritional needs of women and children. So I think that men need to learn about nutrition. In our schools in Pakistan, in middle and high school syllabus, girls learn about food, nutrition, and home economics, and boys learn about agriculture. So women in Pakistan, girls in Pakistan are not allowed to study agriculture in middle and high school. boys have to study agriculture or carpentry or electricity in middle and high school. And what happens in reality is that as soon as the high school is over, majority of the boys in rural areas leave the villages. They go out to earn a living or to, I'm talking about, rural population mostly, or to find a job or do something. And it's the women and girls who stay in the villages. So, and they end up doing the agriculture work, and they have not studied agriculture in school or middle or high school. So the system needs to be realistic to the experiences of men and women. Right now, it's not realistic. The roles are gender stereotypical roles, but they don't match with the needs of either the agriculture or the nutrition. So a number of speakers have said that it is the woman who controls the food and it is the woman who's in charge. But I beg to differ. I think in our society in particular, it's the men who go out to buy groceries. And we have seen that when the budget is low, men would change the list of the grocery that the wife or the mother has given them. So they will cut out vegetables or pulses, but they would definitely buy tea, them, but they will take out the things. In the vegetables also, when the money is low, the emphasis will be on onions and potatoes, but not on carrots and spinach, the things that are needed for the nutrition of girls and women. So I think in terms of changing the gender stereotypical role, both in the household and in agriculture, if boys and men are taught about the health and nutrition needs of children and women, it will impact their choices of crops and seeds and things that can help not only to do more sustainable agriculture, but also do agriculture that will meet the nutritional needs of the family. Thank you.
Thank you very much, Ms. Samina, for those interesting insights on how we can try and change the constructed gender norms or traditions pertaining food choices, food consumption, and things related to the food system. Being mindful of time, I think we had lots of other interesting questions that we could discuss, but because we are running short of time, I would like to pass this over to Felix, and then we can continue in the chat to discuss around the issues we've not touched on. Thank you very much. Over to you, Felix.
Thank you so much, Annette, for that productive session. I think you did very well, and the team as a whole. So at this point in time, we're going to have case studies, and we want to know stories. We want to move away from figures and statistics and hear stories. And our first participant for the day, she's the co-founder for AFCO Investments in Tanzania, which is a female-led business enterprises that sources cereals and grains from smallholder women farmers and then connect them with the market with vulnerable households to process flour. Yes, she is also a graduate in accounting, and she has more than 10 years experience in food processing. I think the rest she can explain herself. Yes, over to you, Fortunata.
Thank you, Felix and all. My name is Fortunata Mari. Actually, I'm brain behind the AFCO Investment in Tanzania, the company that help low-income households to access nutritious food and especially biofortified crops. And I'm going to talk about our business model and how we include women in our business strategy and how women are very important now. And I'm so grateful to be part of this discussion. And I think it's high time and necessary that we bring this discussion and understand that women, there is no way we can leave women behind in our business strategy, in our development strategy, because women makes business sense. So I'm not going to repeat a lot about the data, because the data is very clear, as we have been discussing, that it's women who produce food. Women are the one who make decision what the family eat. And for that case, they are the one who can also contribute in addressing the issue of macronutrient deficiency in our family, in our national and global. So our business model, what we are doing, AFCO investment, we source the raw material, and this is specifically biofortified maize. We are processing provitamin A maize. We source from the farmers, and 32% of our farmers, rural farmers, are women. And for that case, we can see that we include women from our value chain, production value chain, from the grassroots. That will 32% of the farmers supplying their produce to us. They get access to market anyway, it's a source of income. But also, as we said, women is everything to our culture, Tanzania culture. When they produce and sell to us, what remain, they cook as the family food. So for that case, in one side, they get income, but in another side, they ensure that their family eats nutritious food, and this is biofortified maize. In the next stage in our business model, when we source from the farmers, we process, we pack at the different size, affordable price. And as I said, that we make access of nutritious food to low-income consumers, and this is the base of pyramid market. And so we have the different sizes of product, that is 250 grams, 500 grams, 1 kilogram, 2 kilogram, and 5 kilogram. So in our company also, we have women who are working in this process of processing, packing, and even selling. 40% of them are women, so women are there. And we have seen a great thing through these women who are employees of our company. They are not only receive the salary as part of the income, but also we have seen they also sell our product to their community. So sometimes they take product and they ask that we can deduct the money at the end of the month. So we can see that they are good preacher of biofortification in their community. And the other things, as I said, our business model, I'm going also to talk about our sales model. What we are doing, we channel our products. This is biofortified maize. We have two types of product, biofortified maize that is 100% flour, but also we have the composite flour. This is specific for the children from 6 months and above, breastfeeding and pregnant mother. So our sales model is we channel this product through retail shops. These are big supermarkets, but also the small shop, we call the small duka, which they are very near by the household in BOP market. But also we channel through sales agent. And I'm going to talk about this kind of sales model, the sales agent. 90% of these sales agents are young women, and not only women, but they are young ones. They range between 25 up to 30. Most of them are there. 90% of them are women. So what they're doing, these women, we supply them with the product, biofortified product that we are producing. They are going to sell and they are delivered at the doorstep of the consumers. The good thing of this model we have seen is we have found that there is a touch between our sales agent and the consumers. So when they're going to sell the product, they're not only sell, but they're going to talk about the product. And when they talk about the product, that means they talk about the biofortified product. So through this sales model, we found that we also preach the good news about the biofortification to the community that we serve. And if the customer, they have question, they get at least that opportunity to ask. When you compare with the other sales model I said of the retail shop, because there we are just going to send the product and the customer is going to take the product and try to start themselves, and if they're not understand anyway, they can take or they cannot take. But through sales agents who are delivered at the doorstep, they got that opportunity of conversation. And the other things, the other advantage you have seen through this model, door-to-door delivery, in certain community or environment, we found that most of the women, as I said, we serve the BOP market, base of pyramid market, low income consumers market. You find most of the women, they work more than 1 hour or 2 hours going and buy complemented baby food for their children. But when we deliver at their doorstep, that means they get time to, they save time. The time that they will use to work, go and search for the product, they get that time to take care of their children, but also even they save the transport costs that they will use to go to the market. So at this case, we see the real that we bring in women in our business model, in our strategy. And the other model that we are using as Afro investment in delivering our products is that we sell also through institution. When we talk about the institution, we talk about the kindergarten. So we sell through kindergarten schools. There is a children who access our Biofortified product, but also we sell through humanitarian institution. We have 2 humanitarian institutions that we're supplying our Biofortified product. So we can see in general that women, you can find women throughout our strategy, throughout our value chain, production value chain. And really, as I said, women make business sense. Women are the good engine that can stimulate the nutrition movement global. And if really we want to achieve our strategy and want to bring the impact, there is no way that we can leave the women behind. There is no way that we can leave the women behind. So it's good time and high time, and I'm so grateful to be part of this, and I'm happy that now we are discussing about the women, that women, they are key of the changes in the issue of the nutrition movement. Thank you. Over to you, Alex.
Felix, you are mute. We can't hear you.
Sorry about that. I'm saying thank you very much, Fortunata, for that presentation, and more importantly, for explaining to us women's role in the value chain of biofortification and agriculture as a whole. Anyone in the audience, if you have any questions, kindly ask in the Q&A, and then at the end of this session, we'll be able to allow you to ask questions. At this point in time, I'd want to I'm going to give the floor to the second speaker for the day. I mean, she is a Presidential Award winner 2016, having been recognized for the positive economic change she's worked and done with the rural women in India. She has over 13 years experience in community development. And yes, there she is. She'll explain more. Very welcome to you.
Thank you. Thank you, Felix. Hi, everyone. Good evening, good afternoon, good morning. I am Rima Sathe, and I'm the founder of Happy Roots. Next slide, please. Happy Roots is an India-based for-profit social enterprise. We build farm-to-market supply chains, not just domestically in India, but internationally as well. Currently, we have operations in USA and UAE. The unique proposition of our business is that all the backend operations and the assets that we create, which primarily are small manufacturing units, are owned, managed, and run by smallholding farmers and rural women. Next slide, please. So in our value chain, women occupy a very critical and a very important role at each and every stage of the agriculture supply chain, right from the production of the crops that we are involved in to the manufacturing or the conversion of these crops into premium health food products. And as you can see in the middle, the manufacturing units where we do our production are owned, managed, and run by rural women. The marketing and distribution of these products is taken care of by Happy Roots, and a percentage of our profits is invested back into the value chain for capacity development of the women that we work with, which is both women farmers and women who are involved in the production process as well. Next slide, please. This is a quick snapshot of the crops that we work on. These are traditional indigenous grains, which are not only naturally nutritionally rich, especially in vitamins and minerals, but the interesting part is that they are also a key ingredient of the staple diets of low-income households, which especially are the small-holding farmer families that we work with. Today in India, we work with about 120 indigenous varieties of grains, including millets and cereals, which are protected and conserved in community-managed seed banks. Next slide, please. These are some key highlights of the impact that our work has created in the last 8 years on women. Today, we have a network of about 30,000 small and marginal farmers across 5 states in India. Out of this farming network, 60% of our farmers are women. We have been able to double the income of not just the farmers, but the women who work in our manufacturing unit as well. The manufacturing units in smaller villages, what it has also done, it has created skilled job opportunities for women in villages, which are available in their local vicinity and neighborhood. Our model or our value chain is highly scalable, and each small-scale food factory has a potential of creating over 3,000 rural women entrepreneurs across villages. Next slide, please. That's it from my end. In case of any questions, please feel free to write me at rima@happyroots.in. Thank you.
Thank you very much, Rema. Our third speaker has developed an agribusiness model that has provided an opportunity to over 5,000 small-scale farmers and holders a structured route to the market and commercial viable opportunities to transform their livelihoods. She's the managing director and founder for Smart Logistics Solutions. Over to you, Rose Mutuku from Kenya. Rose.
Hello, hi, how are you, everybody? Good afternoon, good morning. My name is Rose Mutuku. I'm the managing director of Smart Logistics Solution in Kenya. Sorry, I can't see my slides. Okay, there. So I was sorry, I was also having a problem with my network, and now I'm actually in my car. So thank you very much. So Smart Logistics Solution is a company that has been working with women farmers and rural farmers in Kenya for a period of now 10 years. And within the journey, we've realized that women farmers are really constrained a lot financially, knowledge, and many other constraints in terms of accessing biofortified foods and also accessing nutrition itself. Even food security is an issue. So a Smart Logistics Solution, then we started processing micronutrient-rich beans, that is varieties of beans that are rich in iron, to process pre-cooked beans and process other foods for the women in the rural areas and also women living in the low-income areas of Kenya. So can you give me the next slide, please? So Smart Logistics, then, we've been a market leader of biofortified bean technologies. We have various products as we run this. We have pre-cooked beans that cook in 15 minutes. This helps the women to even save time that they use to cook beans, because women here in Kenya use about 2 to 3 hours just to cook a meal of beans for their children and for their families. So using 15 minutes and also saving energy and water has been a big innovation for this company. And that also offers high quality nutritious food for the women. We work with more than 30,000 smallholder farmers, and in the bean value chain, we have 5,000 smallholder farmers producing the same. So our vision as Smart Logistics is to be a leader of convenient and nutritious food in Kenyan industry, and of course in the East African region here in Africa. Next slide. So this is one of the processing units that pre-cooks and processes beans within the organization, because now we've placed ourselves to be processors. And why are we processors? We've realized that when women grow these foods, and they have a lot of issues with them, because one, they are not able even to balance the diets in their families because they have low incomes. So when we process the foods, then we are able to balance the diets, to balance the products that we are processing, and we are able to give the same back to the women at affordable prices, and also give them
Seems like we've lost you, Rose. Hello? Hello? Rose, are you there?
City in terms of, hear me?
Yes, now we can hear you. Please continue.
Oh, sorry. I don't know where you lost me, but maybe just give me the next slide. So we have different products that we process. We have now we have soups that are used by women and also by the low-income families to just feed their children. And these meals cost less than $0.3. Then this means that then the women can afford nutritious food. What also we have realized within also the Kenyan community, you find that in the Kenyan community, again, our population, the low-income population, the middle-income population has moved into a lot of feeding into noodles. The noodles are instant noodles that are made from 100% wheat. So we've also added the biofortified beans into the noodle products to be able to bring out a nutritious food. The bean flour that we've been working with, we are selling that to women to actually enrichen the porridge for their children and also for their families. And because women were not able to actually access these porridges in the shelves, then we came up with a product called Nutri-Mix, which then the women are using to make porridges for the children, for the families, and actually access nutritious foods. Because one thing that also we have managed to realize as we move along the chain, women understand what is nutrition, but how to get it is also a problem. And some of them also don't have the capacity to be able to get the nutritious. So having biofortified products is a key thing in ensuring nutrition in the family and in ensuring a balanced diet in the family, because they don't have to mix many products. They don't have to go out there looking for everything to just balance a diet in their family. They're getting most of it under one meal. And that's what we are doing, also trying to see that women are accessing nutrition, women are planting products that are nutritious. And of course, at the same time, we are, all these products that they're growing along their farms, those ones that are farming them, again, becomes a food in their table and becomes a livelihood for them. So our model is a mixed model that we use to ensure that women actually access the foods, and we are also able to process and market the same to low-income population. So next slide, please. So of course, I've talked about our market where we target the low-income consumers. We distribute mostly through the retail shops, and of course our products, all of them are between 0.3 to $0.5 per serving, per family, per serving of a family. So this also makes it very nutritious and very affordable. I think I talked about this last, so I won't repeat it again. Next slide, please. So what is our unique selling proposition? So as we're talking about biofortified food, we are also having a lot of challenges in the market out there. the population does not understand what is biofortification, which I think is an effort that all of the stakeholders will be coming together to put together and for making people understand what is biofortification. Because as we put these foods on the table, then we find that although they are affordable and they are valuable, the population needs to understand what is biofortification, because most of them confuse biofortification with a GMO. Next slide. So the impact that we have as a company overall is to have a healthy and affordable diet for the population, and also have a sustainable process that moves the biofortified products from the farm all the way to the market. So thank you for listening to me. I think that's the last slide. Next slide, yeah. So yeah, thank you.
Thank you very much, Rose, for that wonderful presentation. I think it's very evident that women hold bargaining power at the household level. And if at all we were to fight this hidden hunger, they're very crucial players in this fight. At this point in time, I want to introduce our next speaker, and apologies, initially there was a confusion. She's not a panelist, she's a case studies participant, and she has 14 years experience in maternal, child, and nutrition, and she's going to give us a presentation. So over to you, Nazdin.
Yeah, thank you. I was an ordinary woman until Jano Project empowered me as a woman entrepreneur. No, I'm not saying this. This is reflected one of our women entrepreneur. Dear organizer, thank you for having me here and giving me opportunity to share our experience. Learned audience, I'm in my presentation, I will share our, I'm overseeing a nutrition governance project, which is a joint action for nutrition outcome, which is EC funded project, consortium project. So we recently have conducted a study, which is styled as a scoping of fortified food product for the targeted households and strengthening the distribution network to the last mile. So in my presentation, I will give very light touch of the findings, and I also delighted to share one of our success stories from our program initiatives. So next slide, please. Next slide. Yes. So background very briefly. In Bangladesh, 50% of pregnant women are suffering from anemia, and 57% of non-pregnant and non-lactating women are, zinc deficient. And you can see here that female-headed household, they are more insecure in food than the male-headed households. And malnutrition is during the pregnancy is strongly associated with the child malnutrition. They are 13% more at risk to be stunted. And in Bangladesh, that 36% of children, they're not getting the zinc from their diet. Next slide. So what is the issue? From our program, we have learned that benefit of biofortified crop is not well known by our community, and limited access to input and extension service is one of the key challenges to strengthen the value chain. And in Bangladesh, rice is staple food. So biofortified rice with zinc is one of the unique opportunity to address this macronutrient deficiency. Next slide. So these are the study findings. Very briefly, you can see that graph right hand, which says that it highlights that zinc, only very little respondents, number of percentage of respondents, they identified zinc rice as a fortified food. And also you can see the left side graph, which also tell us that zinc and B12 as a macronutrient, very, very little respondent heard them about these two macronutrient component as a macronutrient deficiency. Next slide. And there are some more qualitative findings reflected in this slide. And I'll also just focus this graph, which also tell us that household head or husband or father-in-law, they are the key decision maker to purchase the food, especially fortified food from market. Yeah, next slide. So these are some of the factors we find out from the study which facilitate or hindered the food fortified food purchase from the market. Those are some internal, external. So I'm not going to read out as I have time constraint. So next slide. Yeah. So we have some recommendation from this study. We need some public-private joint initiatives to, develop women as entrepreneur or agri input seller or retailers. So government should come forward with some gender-sensitive policies. They should have some women entrepreneur initiatives. So, they should have some financing with especially targeting the female friendly financing, especially targeting the unbanked women. So to strengthen the distribution network, I think private sector from their corporate social responsibility, they should take some initiative to women as to develop them as an agro input or retailer. And also they should, have some biofortified crop in a small sachet or small sizes, which is affordable, and also with their subsidy prices. I think next slide. So in our program, we have some strategies to, we try to building trust and transforming the choice of food habits. So we organizing some promotional intervention, like, organizing some Field Farmers Day. We organize media campaign so that people get aware and increase their knowledge on the biofortified crop and fortified foods. And, to strengthen the distribution network and supply of zinc rice seeds to the last mile, we are engaging retailer, we are engaging the private sector. We are also engaging, making the bridges to the government to the farmers. So we have, we trained 270 retailers, where 16 are representing by female retailers. So we link them with the private sectors to make their, the inputs available in their shops. And we have a gender inclusive business model to empower, to develop women as an entrepreneur. So by next slides, I'm going to share one of our success stories. Next slide, please. She is Nasima, which at the beginning of my presentation, I just reiterated her quote that she was an ordinary woman, and when she engaged with us, we tried to give some training by the private sector, and we also introduced her with her product bucket to the community. And introduced her as a woman entrepreneur. We also linked her to private sector. We also linked her to the retailers. So Nasima, now she is, after 1 year of this initiative, she becomes successful, and she is reaching to the last mile to the farmers at her catchment area. And in every month, she is incoming $20 on an average. So now she is dreaming to be a dealer of a big seed company, but she needs, big capital to fulfill her dealer criteria. So, which is, in Bangladesh, a common challenge for small female farmers. They don't have their own bank account. And, the high rate of the bank interest is also another obstacle for that financing. And she need now to grow up, she need the literacy training to maintain her business account. So we hope that she would fulfill her dream and to be a big business entrepreneur. Thank you for your patience and hearing me. Thank you.
Thank you so much, Nazneen, for such an amazing presentation. It is because of women such as Nasima that we get encouraged that women will finally not exert their influence in this key decision making within the value chain of biofortification and agriculture as a whole. Having said that, I'm going to, sorry, I didn't introduce myself. My name is Felix Brown Onyango. I'm the Communications Associate for Commercial Biofortified Crops Program. Yes, at this point in time, I want to hand over the program to Sharon Ogola, who's going to make the closing remarks.
Hello, everyone, and I would like to thank the participants for finding time in their busy schedules to listen to our webinar, and I would also like to thank the panelists for also sharing and telling us more about women in biofortification. So today's webinar centered on building best practices and recommendations to adopt a gender-inclusive nutritional strategy in the commercialization of biofortified crops, while breaking down barriers and changing social norms to partner with both men and women to accept biofortified crops. The advent of good seed systems, the development of markets and products, and demand creation enhances this possibility become a reality. You can find more information, presentations, and resources on the Biofortification Gender Inclusive Nutrition Strategy webinar at the link which Karen has just put in the Q&A. I would like to thank you again for being part of today's event, and we look forward to having you join us again. Thank you very much.
Thank you, Sharon. Thank you very much for that closing remarks. Just before we leave, there's one question for Fortunata. The question is from Setegen Gebehu, and he's asking, if you're processing biofortified varieties, do you offer premium price to farmers who supply raw beans to your company? I repeat, if you're processing biofortified varieties, do you offer premium price to farmers who supply raw beans to your company? Is there any difference between the prices of biofortified and conventional bean varieties? Rose, yes, the question is for Rose Mutuku, Kenya. Thank you.
Yes, we offer farmers a premium always because they are able to give us quality products. They're also able to give us by a very good product. So for example, you'll find a farm gate in most of the areas, beans are 0.5 over kilo. That's the average, but we offer farmers between 0.7 to 0.8 over kilo, but still we deliver it cheaper at farm gate, at factory gate. That is at around 0.9 as opposed to buying from traders at 0.8. So yes, we offer a very good premium to the farmers and incentive to grow the biofortified beans. Thank you.
Thank you very much. Thank you, everyone. Thank you for creating time to join us today for this biofortification webinar. We hope that this conversation shall continue going forward, and we shall have a gender-inclusive nutritional strategy in the long run. Till next time, thank you.
Thank you so much.
Thank you so much. Thanks for your contribution and time.
Hi, Isham. Thank you. It was good.
Thank you. Thanks for tuning in.
Yes, you never liked me in this song, and that's okay. I wonder if you knew my name. I guess I'll just go fuck myself. Yeah, I might as well go fuck myself.
Sweet. So good music. So